let's talk about health shares. So, if you're thinking about joining a health share or any kind of other health insurance alternative, the big point to remember is it's not insurance. Usually, you'll see something that says health insurance alternative or medical insurance alternative, or we pay your medical bills without insurance. Right. So the thing is, it says it in the name, alternative to health insurance or medical insurance. If it doesn't have insurance in the name, it's not insurance. And that's important is because insurance is regulated, really highly regulated by both the federal and state governments. So you have two levels of protection when you have health insurance, when you purchase a health insurance plan from not just the state level, whatever state you're in all 50 states, there's some kind of protection. Also in the federal level, and no matter what state you're in, you have these levels or layers of protection. And why this is important is because a health share, if it's not regulated or any kind of other entity that says, hey, we'll contribute, let's come together and cover each other's health insurance bills or medical care needs. And often, they come together with the same kind of like ideology, or they have the same belief system in terms of how the system of things should be run, or they have the same kind of professional background, like a freelancer kind of thing. That's great. That's awesome. The problem is that, number one, because it's not health insurance, it's not insurance, you don't have the protection. So the thing is that number two, these health shares, you pay into it regularly with regular premiums, and then you request for reimbursement when you pay for care. So the thing is that if the health share doesn't have enough money to cover all of the payouts, it goes bankrupt. Frankly, it's just math. And there you go. So that's the number one issue with health shares, that because of the economics of it, not the economy as like a whole, the economics of just the math, that's a real risk. The other thing with health shares is that they don't cover pre-existing conditions, and that's how they can kind of have any hope of staying solvent, is by not covering pre-existing conditions. Now, the problem is what's considered a pre-existing condition. Let's say that you're a happy, healthy 25-year-old and you injure your knee in a basketball game or something. And 10 years later, maybe even 20 years later, you have an issue with that same knee. The health share will ask for medical records. And if there's any documentation that shows that there was an issue with that knee prior in the past, no matter how long ago it was, is considered a pre-existing condition. And there you go. You have this big knee surgery that you're looking at, easily 10, 20 or more $1,000s. And you're on the hook. It's you if they say they're not going to cover it, meaning considered a pre-existing condition. Now, what health shares often do is they say, yes, we can't cover pre-existing conditions, right, to be able to stay solvent. But what we do is we help you, or sometimes we'll even negotiate a lower rate for your care if it's considered a pre-existing condition. So that's a benefit you get with a health share or other health insurance alternative where you pay monthly, regularly, a premium of some sort. And then if, God forbid, you need to submit a request for healthcare, you have to have medical care. You submit a request for reimbursement. Often they'll say, hey, ask your provider for a UB04 form, which has the CPT codes that they usually send to insurance companies. Well, they send them to you too. It's your health information by HIPAA federal law. You have a right to that same information. So the health share will say, okay, whenever you have something that needs to be reimbursed a health or medical expense, send us the UB04 form and, we'll pay it out. So there you go. You don't have the same issues with the risk of bankruptcy or not having coverage for something with regular health insurance or medical insurance, because again, they're required to do certain things because they're very regulated to keep things from happening like, oh, so sorry, we're bankrupt. Yeah, that's not a thing with health insurance in this country because of the regulations on the federal and state level. So there you go. The truth about health shares and other health insurance alternatives. And you can find out and get more support at medicalbillrelief.com.